Hi and welcome to River Oak Health. I'm Shane Jeffrey and I'd like to thank you for taking a little bit of time out of your day to get to know us a little bit more. What I'd like to share with you today is a little bit around what we do, how we do it and why we do it. And to start off with, I'll start off with what we do. So as you might have already guessed from the website, the things that we do are related to eating disorders, weight management, and there is a catch on that one which I'll talk about, and also the broader context of eating, weight and body image concerns. Now the catch regarding weight management is the approach we use is what we call a non-diet approach. And what that means is we don't do diets and we don't focus on weight. And rather than using that traditional method of calorie restriction, etc., for helping people manage their issues around health, what we do is we focus on trying to support people in building a positive relationship with food and a positive relationship with their body. And that all stems from the fact that weight is not a good indicator for health outcomes. We know there are people who are of larger size who are healthier than people who are of a smaller size, for example. And so what we do is when we're working in that area of weight management, we use that non-diet approach and we take the issue of weight and park it in the corner, which generally creates space to work on the relationship with food and some of the dynamics that might be happening there. Now another area that we work in is the area of sports nutrition. So we work with recreational and elite level athletes to help improve their performance. And then we also have special interest areas which really relate to disordered eating in diabetes and also disordered eating in athletes as well. So that's a little bit about what we do. In terms of how we do it, we've got five key principles that we work on in terms of building into our treatment approach. So the first one of those is research. So we try and stay up to date with the research, we use evidence-based practice, and we combine that with a couple of other principles, which are our own experience. So over the 20 odd years we've been working in the field, we've built up a lot of experience in these areas. And we also value the client's experience. One of the things I say to people is one of the things I've learned most from in all of my learning opportunities have been the people I'm working with. I'm so grateful for that. I often think I've learned more from the people I've worked with than what I've learned from textbooks. And I think that says a lot about the people we work with are just wonderful people. We also work in a very collaborative and customised way. So we work together with the clients in terms of making treatment decisions, and we also customise treatment to suit each individual. So irrespective of diagnosis, what we do is we work with the client to try and come up with a treatment plan that suits your specific need. Now the way we think about this is a little bit interesting. I guess the way we think about our consulting room is a bit like a rally car, in that as a dietitian, I sort of see myself as a navigator and we see our client as being the driver. And so we take that approach because ultimately it's the driver and it's the client who's going to determine where we ultimately go. My role as the navigator is to try and provide some direction around where we go, what we do, how quickly we get there, etc. And then we've also got the support team or the support squad, which are the people around the person we're working with. So from an eating disorder point of view, that might be family. From a sports performance point of view and a sporting perspective, it may be the coach or other team members, etc. And so we try and work very, very closely in a way of bringing together this collaborative and customised care. And an extension to that is the last principle, which is really the inclusion of those support people. We have a really inclusive approach to the work we do. We invite parents, partners, friends, coaches to sit in on session, because I think when we're talking about changes to eating and what we're doing and where we're going with food, we really want everybody to be on the same page. And so we have that really strong focus, I guess, on working together as a team. Now a little bit about why we do what we do. As a team, we are passionate and committed to helping improve the lives of people. From my personal experience, I've been working in this area for around about 20 years across those areas that we practice. And I can still remember the first patient I saw with an eating disorder. And when I get talking to about her, I get quite emotional because it had a profound effect on my career. I went into nutrition to study sport dietetics and be a sports dietitian. And then I started working with eating disorders, and I really, there was just something about it that grabbed me. And so when we've recruited and expanded our team, we've really looked for that passion and understanding, and we've extended that a little bit because we've got a lived experience person on our team. So somebody who's lived with an eating disorder and is now doing very well in recovery. And we find that can be a helpful tool for some people when they go through treatment. So hopefully that gives you a little bit of an understanding around the River Oak service in terms of what we do, how we do it, and why we do it. But we understand that our service may not be for everybody. And so I'd like to thank you for taking the time to watch the video. And, would also like to wish you well going forward, whether you choose to use our service or not. So, in the interest of health and well-being, I wish you well for the future, and thanks for taking the time to get to know us a little bit better. Thank you.